Okay, in this presentation, I will be focusing in on the lateral elbow and on how to correct for a poorly positioned lateral elbow. Now, the best place to start would be to review the anatomy of the distal humerus, as it is a little bit complicated. Okay, we have three parts which form the distal humerus. We'll start laterally and then we'll track medially. Most laterally, we have the capitellum over here, and this tracks with the radius. Then we have the trochlea over here, also over here. As you can see, there are two portions which form the trochlea. We have the trochlear groove, which is narrow in diameter, and we also have the medial lip of the trochlea over here and over here. And thirdly, we have the medial epicondyle over here. So those are the three parts of the distal humerus, and knowing how they look like is crucial to being able to spot them on our lateral elbow image. Now, what does a good lateral elbow look like? Basically, the capitellum and the two parts of the trochlea are all superimposed. Now, I'll quickly go through briefly now where they are. So over here we have the capitellum. It is the most posterior structure. It comes in over here. This is the posterior part of the capitellum. The trochlear groove is indicated here by the white line over here. Remember, if we go back over here, this is the trochlear groove. And over here, it is over here. That is the trochlear groove, the central part of the distal humerus. And then we have the medial lip of the trochlea, which is a little bit difficult to spot on this image because everything's superimposed. However, it starts over here and it tracks over here. Medial lip of the trochlea. And then finally, we have the medial epicondyle, which is very easy to spot. Here it is over here. Here are the edges of the medial epicondyle. Now, on a properly positioned lateral elbow, the medial epicondyle should be positioned centrally within the distal humerus. It shouldn't be positioned posteriorly, nor should it track anteriorly. It should be centrally located. And the final point on this slide is that the capitellum should be the most posterior structure. In other words, just like I said, the medial epicondyle shouldn't be sitting over here. So those are some of the basics on what a lateral elbow looks like. Now we will go just a very important point about knowing the anatomy. When it comes to, say you've taken an image of a lateral elbow and you know it doesn't look right and you know it should be repeated, you need to be able to spot the capitellum or the trochlea or the medial epicondyle in order to correct it. Now, you don't need to be able to track the entirety of the capitellum or the trochlea, but you just need to be able to spot a small part of it. Just like, for example, on a lateral knee image, say if you've over-rotated the patient and you can see the adductor tubercle posteriorly, all you need to spot is that adductor tubercle, and you immediately know that you've over-rotated the patient. You don't need to be able to track the entirety of the medial condyle or the lateral condyle. You just need to see a small portion of it and you can figure out the rest yourself. And the same concept applies over here. You just need to spot a small part of the capitellum or trochlea and you can figure out what's going on. Okay, now how to spot the capitellum and trochlea. Here are some important tips. The first, the capitellum is the most posterior structure and it has a smooth surface posteriorly. Anteriorly, it transitions sharply into the distal humerus. Now we'll see a few examples of that in just a moment. Now the trochlea is the opposite of the capitellum, which I just said that the capitellum has a smooth surface posteriorly, whereas the trochlea has a smooth surface anteriorly. Now we'll look at a few images. So over here we have nicely outlined the capitellum. It's got a smooth surface posteriorly, comes around over here. Now anteriorly, it digs into the distal humerus over here, and it continues on in this fashion over here. Starts posteriorly, it's got a smooth surface, comes around, and then it digs into the distal humerus. Sometimes you'll be able, or most times you should be able to see this on a poorly positioned lateral elbow, and that can be an indicator as to where the capitellum is. The trochlea is different. The trochlea can most easily be spotted anteriorly. It's got a smooth surface anteriorly, and this is usually the most you'll be able to see of the trochlea. So look anteriorly, you'll see the trochlea. Look posteriorly, you'll see the capitellum. Now, capitellum and trochlea, how to spot them. First, we'll start over here. Over here, we are looking at the lateral aspect of the elbow, and this image is slightly rotated over here. So just like I said before, capitellum it has a smooth surface posteriorly. It comes around. As it comes back into the elbow, it cuts into the distal humerus over here. There is a capitellum there. It cuts into the distal humerus. On an image, what does it look like? Well, over here is the capitellum, comes around, and then it digs into the distal humerus, just over here. And over here, it's nicely outlined with a line where the capitellum is. Okay. And we have the trochlear groove over here, which is indicated over here. And over here we have the medial lip of the trochlea. Look at the smooth surface of the trochlea over here. And you can also see it over here. The smooth surface over here within the trochlea. Now to spot them on a lateral image, capitellum and trochlea. Once again, capitellum, always start looking at the capitellum posteriorly. So here we have the capitellum over here. It comes down over here. And as I said before, the capitellum, as it tracks anteriorly over here, it will dig into the humerus over here. So we'll start again. Capitellum comes down over here, and over here, and it digs into the humerus. Whereas the trochlea, the easiest way to spot the trochlea, look anteriorly. General rule of thumb, look anteriorly. So if you look at the trochlea, look at the anterior edge here, and here is the trochlea. Comes down over here. There is the trochlea. Okay, and then we have the medial epicondyle, very easy to spot. It's centrally located within the distal humerus. So applying the same rule again over here, here's another example. Capitellum, always start posteriorly. This comes down over here, then it comes over here, and then it tracks, then it cuts into the distal humerus. We'll try that again. Capitellum comes around over here. You can see it over here. Then it digs into the distal humerus. Whereas the trochlea, look anteriorly. Here it is over here. It's got a smooth surface. Oh, it's a little bit to distinguish over here. It's located over the radius, but you can clearly see it over here. Okay, so that's capitellum and trochlea. How to spot them. General rule of thumb, for capitellum, look posteriorly, start posteriorly, and for trochlea, look anteriorly, and look for that smooth edge. Now, for correcting a lateral elbow, there are two basic corrections you need to make. Either you need to raise or lower the distal forearm, or you need to raise or lower the proximal humerus. Now, so we'll start with a few case studies. Now, with these case studies, the best way to learn this is to stick your arm out or into a lateral position so that your elbow is flexed at 90 degrees as if you are the patient. And then what you should do with each of these examples is as you raise or lower the arm, or raise the table or lower the table, see what happens to the trochlea and capitellum and how they move in relation with each other. So we'll start with the first case study. Now we just looked at this picture. We were able to spot the capitellum coming posteriorly over here, and then it cuts into the distal humerus. And over here we have the trochlea coming down over here, somewhere about here. We can't fully determine where the trochlea is, but what we do know is that the trochlea is over here, whereas the capitellum ends over here. The trochlea is positioned distal to the capitellum. I'll show that again. Where is my mouse? Here is the trochlea, the edge of the trochlea, and here is the capitellum. So the trochlea is positioned distal to the capitellum. Now stick out your arm into the lateral position. Now we need to determine what we need to do. So if we raise the hand, take notice of what happens to the capitellum. Now remember, the capitellum is located laterally in the elbow. So if I raise the hand, the capitellum swings posteriorly. If I drop the hand too much, the capitellum swings anteriorly. Now in this case study, the capitellum is located, I would say posteriorly. If I get my mouse, it's in this direction over here. We need to swing the capitellum in this direction over here. And so to do that, we need to raise the hand up a little bit. So this is a good case study to show that we don't need to be able to see where the full length of the trochlea is. All I needed to do is see that the capitellum is over here, and the trochlea was somewhere over here, and we were able to determine how to correct for that. Second case study. Now, for this one, we actually don't need to have a look at the capitellum or the trochlea. Immediately, I can see that the medial epicondyle is positioned way too posteriorly over here. It's way too posterior. This needs to be centrally located within the distal humerus. Now, if we stick out our arm again, if we raise the hand too high up, look what happens to the medial epicondyle. It swings anteriorly. Now, if I do the opposite, take note of what happens. If I drop the hand, the medial epicondyle swings posteriorly. And that's what's happened over here. So to correct for this, I need to raise the hand so that the medial epicondyle becomes centrally located. Case number 3. We've looked at this one before. We will start by tracking the capitellum posteriorly. It is over here. Over here, over here, over here. Then it cuts into the humerus. Trochlea, very easy to spot. It can be spotted over here, and it comes down somewhere over here. What I can tell immediately is that the capitellum is located posterior compared to the trochlea. Here is the capitellum over here, and here is the trochlea over here. Basically, the table position has been altered in this case study. So stick out your arm again. We need to determine what has happened over here for the capitellum to be positioned too posteriorly. Now, if I raise the table, take note of what happens to the capitellum. Now, remember, the capitellum is laterally located. If I raise the table, the capitellum swings proximally or anteriorly, whereas if I drop the table, the capitellum swings posteriorly. So that's exactly what's happened here. The table has been dropped, so to correct for this, I need to raise the table. Okay, and yep, that's correct there. Case number 4. This is a good case because a lot of radiographers would pass this and not correct for this. So over here, we'll start with the capitellum over here. Comes down over here. Very easy to spot the capitellum for this one. Here is the capitellum. Now the smooth surface of the trochlea is a little bit difficult to see in this one. This isn't the trochlea over here. This is just the normal distal humerus. It's somewhere hiding over here. So we can see the capitellum over here, We can also see a little bit of bone projecting into the elbow joint. Now this can't be the capitellum because we've just located where the capitellum is. So we know immediately that this is the trochlea. You can see the edge of the trochlea over here. The edge of the trochlea over here. So over here. Somewhere over here. So the trochlea is down here, whereas the capitellum can be much easily be located over here. Here is the capitellum. So what's happened here? Stick out your arm again to determine what's happened to the trochlea for it to be positioned to posteriorly and distally. So if we raise the table, that swings the trochlea posteriorly, and that's exactly what's happened here. The table has been raised too high, so to correct for this, I need to drop the table. Case number 5, and this will be the last case. So we have two problems in this case over here. We'll start by identifying the anatomy. Again, we'll start posteriorly with the capitellum. So the capitellum comes down here. Immediately I can tell that the medial epicondyle is positioned too posteriorly because it is touching the capitellum over here. Okay, so over here we have the capitellum comes down over here. We can track it over here. Now over here it's a little bit difficult to draw a line between this portion and this portion. So what I initially did with this case is I looked over here. Where's the mouse? Here is the capitellum. Is this trochlea or what? Let's track it. Where does it go? It cuts into the humerus over here. So because it cuts into the humerus, I know immediately that this is not trochlea, but this is all capitellum over here. So here is a capitellum. If this portion was the trochlea, it wouldn't cut into the distal humerus. Rather, it would track more anteriorly, and it'll have a smooth surface over here. But that's not what happens. It cuts into the distal humerus. So what we have here is a capitellum projected in this direction and in this direction. We have two problems here. So stick out your arm again. We need to determine what's happened to this elbow or to this arm so that the capitellum is positioned in this direction and in this direction. So if we drop the arm, that swings the capitellum distally. Also, now if we drop the hand, my apologies, if we drop the hand, that swings the capitellum distally. Also, if we drop the table, that swings the capitellum in this direction over here. Let's go back one slide. That swings the capitellum down in this direction. So in this example, the table has been lowered and also the hand has been lowered. So to correct for this, we need to raise the hand and raise the table. And here we have the anatomy indicated, capitellum just over here. Okay, so if you want to practice these, any case studies at work, stick out your arm and just notice what happens to the capitellum and trochlea when you drop the hand, raise the hand, drop the table, raise the table. Pay close attention to what happens to the capitellum, trochlea, and medial epicondyle, and within no time, you wouldn't have to go through all this trouble to determine how to fix it. You will be able to know immediately. Now, all these images have been sourced from this website over here. This website is quite dense in material, and I've summarized it in this presentation.